Uganda, now in the fourth week of the 42-day lockdown, planned to have at least 60% of the population vaccinated in order for business to resume normally. The Ministry of Health, working with partners like the COVAX facility, UNICEF, African Union, and other countries, garnered over 1 million doses of the AstraZeneca vaccine. As of today, 878,890 people have received their first dose and 201,033 are fully vaccinated. However, this is still a drop in the ocean compared to the required threshold. While appearing before the COVID-19 Task Force Committee in Parliament last week, Health Minister Dr. Jane Acheng was tasked to explain when the country should expect the other vaccines.
How long are we going to take?
I have said I don't know. I don't know whether you want me to say it in my language or in English.
Dr. Acheng also said the first world countries purchased and are hoarding vaccines and causing a global shortage. Uganda has now paid a total of 41 billion shillings through various arrangements, but is still unable to get vaccines due to the overwhelming demand.
All the vaccines that is being given as donations are vaccines
Mr. Chair, inquiry.
that were procured
Please.
by the rich
Please.
countries
Let the minister.
and
we are
they
going
were
a mess.
hoarded, and now the rich countries have started to donate. That is what we are getting. But from the manufacturers, they are not yet giving vaccines directly to the poor countries.
However, the ministry expects to receive more than 580,000 doses of COVID-19 vaccines, according to a timeline schedule published early this month. Dr. Cheng said there is the option of buying from third-party sellers, but this is risky and much more costly.
If this parliament thinks we can buy vaccines at $29, at $20, tell us we shall cost. Then we can procure if we have the money. We are doing things within our means.
Some health experts think that the continued stringent measures like the lockdown are unsustainable and government should rethink its interventions, especially towards vaccination.
The government needs to go and negotiate for these vaccines. The government needs to work using bilateral agreements. It is very, very important that the government of Uganda thinks about itself now as one of those that are in the business of vaccines, by going to these other multilateral countries and convincing them to get vaccines at a price that is possible.
If we remove those gathering-related activity, what I believe we can still be able to buy time as we also get the economy started and get the vaccines slowly trickling in. So when the vaccines come, we should ask government to be more, put money behind looking for these people and immunizing them. That way we shall get more coverage.
Uganda is not alone. Africa, whose 1.3 billion people represent 16% of the world's population, has received less than 2% of the COVID-19 vaccine doses administered around the world, according to the World Health Organization. Walter Mwesije, NTV.